name is Chris Allphin. I'm a board-certified OBGYN for Monarch Healthcare in Idaho Falls, Idaho. Today, I'm going to talk about the third and final trimester. During the third trimester, visits change frequency. We will now be seeing you every 2 weeks, and at the very end, weekly. One of those visits, you will be getting the pertussis vaccine. The CDC recommends that you get this vaccine every pregnancy, regardless of the last time you were vaccinated for this. During the third trimester, you'll have noticed that you may have gained some weight along the way. This is okay. Typical weight gain is 20 to 40 pounds. If we notice a large increase, say 10 to 12 pounds over a week, we may worry about some other conditions. But for the most part, this is a very common amount of weight to gain. Common complaints in the third trimester are increasing maternal size. That baby's getting bigger, and that baby is kind of running out of room. You'll notice more pressure in your ribs. You might be more short of breath. You might have pain in your upper abdomen. These are all very common. If you experience increased pain that you think is abnormal, call the doctor. Also, at this time, you're going to notice regular fetal movement. You may have a slight decrease as you approach your delivery date, and that's normal, but you should still have 10 distinct movements over 2 hours. Oftentimes, we do kick counts. Kick counts are where you eat something, hopefully with a little bit of sugar in it, and then lay on your left side, focusing on the movements of the baby. If you get to 10 distinct movements in a short amount of time, then your baby's doing great. However, if after 2 hours your baby has not moved 10 times, please contact your physician or go to the hospital. During this third trimester, emotionally it helps to do what is called nesting. Nesting is a term where you set up a baby's nursery. This can be in the baby's own room, maybe it's in your room, but you get what the baby needs for when you first bring the baby home. This is an important emotional time for you and your partner to feel this sense of relief that you are prepared and will be prepared for when this baby comes. I recommend childbirthing classes. This is a great time for you and your partner to experience a childbirthing class. It will educate you on what to expect when you go in to deliver. There are a lot of unknowns with the delivery process. Some people don't recognize that you will get an IV placed, and some people are kind of confused as to why. This class will provide answers, and it will also be able to let you know what kind of questions you should ask your provider about delivery. You can contact your hospital for available dates and times of classes in your area. During the third trimester, it's very common to start to feel contractions. Early on, from 28 to 36 weeks, they might be small. You might notice a small tightening of your abdomen. These are most commonly referred to as Braxton Hicks contractions and don't generally cause labor. If you start experiencing them more than every 10 minutes and they're increasing in pain, I like to recommend relaxation techniques, such as eating something, taking a bath or shower, and putting your feet up. If they still increase, I recommend going to the hospital to be evaluated for preterm labor. After 36 weeks, I want them stronger and more frequent to call it labor. Contractions every 3 to 5 minutes and so painful that you can't smile through the contraction, that's when you're in labor and that's when you should go to the hospital. Also, if your water breaks at any time, please go to the hospital.